Tuberculosis, or TB, and historically called consumption, is a disease that affects the lungs. It is a bacterial disease. Some people infected with tuberculosis never even feel it or get sick, while others get met with tragedy. It all depends on the immune system. In fact, only a small amount get infected, actually feel the disease, about 5 to 15% of people, but about 1.23 million people die of tuberculosis every year. What are the causes of tuberculosis? Tuberculosis is caused by a bacterium called Mycobacterium tuberculosis, or just M. tuberculosis. It is a bacterial infection. When people breathe it in, it can settle in the lungs and begin to rapidly grow, deteriorating the body in the process. What are the transmissions? It can be spread when someone coughs, sneezes, or even sings, spread via the airborne route. It puts droplets in the air and another person can breathe it in and it can severely affect them. It spreads easily in huge urban areas and especially with people that already have other diseases like HIV and AIDS. They have a high chance of being infected. White blood cells see that they're invaders, and plasma B gives the M. tuberculosis antibodies to track it, and the macrophages and T lymphocytes, or T cells, kill them. What are the symptoms of tuberculosis? Symptoms can be as mild as being tired with a cough and with a low fever, but over the course of weeks, it worsens. You develop chest pain, night sweats, inability to breathe or cough properly, ruined appetite and energy, and weight loss. It impacts your entire body, like the lungs, of course, kidney, liver, skin and bones, heart, genitals, voice, etc., etc. There are preventions and treatments. For preventions, it is kind of difficult to determine what can you do to prevent it, especially if your immune system can't handle something like tuberculosis. It's a sad reality. You can try your best to be as hygienic and as safe as possible, but it's the kind of disease that doesn't really discriminate. Treatment involves usually a 6-month course of antibiotics and preventative treatment. Medication is how we cure it, but the places in the world where people suffer still from TB are impoverished and war-torn, with not a lot of funding going into Medicare. It's heartbreaking. That is Tuberculosis Simplified.